Hi, Mr. Sayers? Hey, how you doing today? Blake Lusselroth.
When it comes to medication reconciliation, we tend to assume two things. First, patients don't know what they are taking. And second, providers always know what patients are taking. Unfortunately, these assumptions can cause us to make decisions that circle around the problem rather than address it. For example, providers sometimes skip reviewing meds with the patient because they're confident everything is already in the chart.
I don't know. Whatever they gave me, they said they put in the chart.
Okay, so usually...
While patients are confident everything is already in the chart, so they may skip speaking up about their meds.
Pitigrel. All right. Okay. How about this? Would you remember it if we pulled up a picture? Maybe you'd recognize it. Okay. Let's do that.
If everything were in the chart, we wouldn't need medication reconciliation in the first place. In fact, there is often a big difference in what we assume to know about meds and what we actually know about meds. It can be a challenge to maintain an accurate medication list. For instance, within the VA, 15 to 25% of the time, the patient is not taking one or more medications reflected in the chart. 11 to 13% of the time, the patient is taking one or more medications that are not in the chart at all. And 6 to 24% of the time, the patient is still taking medications even after the prescription is expired or discontinued. We also know that 2 to 8% of the patient's actual medication list includes medications that are managed at remote VA facilities, and that 23% of the patient's allergies are not documented in the system. Clearly, there is no longer room for assumptions. So how do we begin to get at the problem? We know we shouldn't just rely on the chart alone, and we know we can't rely on someone to physically witness every pill we take. But there is a lot we can do to make a difference. The more effort we put into the process, and the more information we uncover, the more complete the picture will be for everyone involved. Some of these items are just theories, but they all begin with a strong partnership between provider and patient. And they all start with a conversation. Medication reconciliation is not only what we ask, but how we ask. It's not only what's already in the chart, but what will be in the chart thanks to our conversations to come. We should never assume what the patient says is wrong and what the chart says is right. We should never assume the provider knows everything. Instead, let's focus on how we can change our thinking and work together toward our common goal: to achieve the best care anywhere.